Good afternoon. I'm George Latimer, Westchester County Executive. This is Monday, March 15th, and this is our Westchester coronavirus update for the beginning of the week of March 15th. I'm here with Deputy County Executive Ken Jenkins, and we're going to go over some things that specifically relate to the COVID virus pandemic here in Westchester County. We'll touch on a couple of other issues, and we have visiting us today the mayor of the village of Ossining, Rika Levin, and we're going to have Mayor Levin come on in a few minutes, talk a little bit about Ossining. You know, we're trying very hard to connect our municipal governments, our local villages, towns, and cities to the efforts we're making in the county. We've worked very hard on a bipartisan basis to do that. Last week we had Mayor Mary Marvin with us from Bronxville, and each one of these communities are a little bit different. Ossining Village has gone through quite a bit during this pandemic, and it went through designation as a yellow zone when we had the color zones that showed infection. And so Mayor Levin, who was a village trustee, who was recently elected mayor, is going to be able to give you a little footprint on that, and she may chat about anything else that she'd like relative to the village of Ossining. So everybody who may be watching this from any corner of Westchester gets a little flavor of each of the different pieces that make up this mosaic. On the numbers, the New York State tracker is up today, so you'll find these numbers available if you want to check it on your own. And then we have our own dashboard, which includes some of these numbers. But in Westchester County, based on the pandemic to date, which now is a little over a year and 2 weeks, 113,204 people have tested positive for coronavirus at some point in time over the course of this period of time. 107,857 had tested positive as of 2 weeks ago in the aggregate. Most of those people have satisfied all the protocols and have moved on from their infection. That gives us, as of today, Monday, March 15th, 5,347 active cases. And that number has been coming down steadily now over the last 6 weeks. Over the last week, it's been close to flat, although still decreasing. A week ago, the number of 5,347 was, a week ago, 5,823. So we've had a drop of 500 cases in a week. We have gone down from a peak of 11,500 back in January to this number now. We've been through this before. If you've been watching this, if you've been tracking the course of the pandemic infection, last year we had a bell curve which steeply rose in March and April, sort of maxed out the flattening of the curve that people talked about, and then it started on a downslope in May, and then got down to the summertime with a fairly low level of numbers. It started to peak back up in the latter part of the fall and spiked over the course of this winter time, particularly from the Thanksgiving, Christmas, and New Year's holidays. And that peak now, second peak, came in January, and now as we're here in the middle of March, we're seeing a continued diminution, which is good news for us because we're heading to the springtime season. Things open up, more outdoor activities, less indoors, less likelihood for the spread. And then, of course, the vaccinations, which we'll talk about in just a second, are the great encouragement that we think puts us closer to putting the pandemic behind us. But in any event, 5,347 active cases, down from a peak of 11,500 in early to mid-January. The number of hospitalizations, our most recent number, comes from Friday, in which we had 252 people hospitalized. The week prior to that, we had 284 on the same day. 2 weeks before that, we had 340. And our peak in January almost reached 600 hospitalizations. We had 588 people hospitalized. We're down now to a workable number of 252, so that's a good sign. Less people hospitalized. If the number of active cases represents the breadth of the infection, the number of hospitalizations represents the depth of the infection. People are so sick that they have to be hospitalized to deal with it. Keeping in mind, most people who test positive when isolated may run a fever, may have certain symptoms, a very bad cold that affects different people differently, but you can work it through your system if you have strong enough antibodies to fight it off. If you don't, you wind up in a hospital setting. And then, of course, the worst of all possible results is fatality. We have had pandemic to date 2,149 fatalities. The last 2 weeks or so, we have had low single digits of fatalities each night. We are not where we were in the summertime where we had weeks of 0 fatalities, and we are not where we were in the first month of the pandemic when we had nights of 30 or 40 people dying in a single night. Every death, I repeat it like a mantra, every death is a human being. It's not a statistic. But we look at statistics to try to determine trend lines, and the trend lines and fatalities are down. In the last week, we had 21 fatalities. That's down a little bit from the prior week where we had 27 fatalities. And if you go back 2 or 3 weeks prior to that, we had about 40 fatalities, 45 fatalities a week. So down to the low 20s is good. We We want to get it down to 0. We don't want anybody else to die from this if we can help it. But obviously, our ability to fight it and treat it with the tools that we have, which we've long since talked about, social distancing, mask wearing, hand sanitization, and now vaccine usage. But the numbers are encouraging. Again, I say that now. I've said that now for about 3 or 4 weeks because we're not there yet. We had a significant drop to go from 11.5 down to these numbers. We know that you almost have to have no further infections in order for those numbers to drop for the second half of that, to go from 5,300 down to 0. And we know that the virus is still very much out there, and we're still very much concerned about it. On the vaccination front, Westchester is in I think, a uniquely good situation. We have, as of last week, there's not up-to-date numbers as of today. As of last week, we had 13% of all Westchester residents have been fully vaccinated against the disease. And keep in mind, the eligible categories for vaccination are people 60 years of age and older, and that 60 to 65 cohort is just about a week in duration. We have people with underlying health issues that are eligible, and we have people in certain occupational cohorts that have been made eligible, whether it's first responders, hospital workers, and now branching off into more individuals, which we're going to cover. Ken's going to cover some of that when we get into the next category that's been opened up of local governance. But we've had 13% fully vaccinated, which means both of the Pfizer or Moderna shots or the one Johnson & Johnson shot. That represents full vaccination. You wait about 2 weeks after full vaccination, and then you're seen as having proper protection from you getting the disease at all. And that's 13% of the population. An additional 11% of the population has had at least one of 2 shots, either Moderna or Pfizer. I'm in that category. Had my first shot a week ago Friday. I'm waiting for the second shot the first Friday night in April. And looking forward to joining that cohort of fully vaccinated individuals so that hopefully will help us move forward. Our numbers as a percentage of our population is good, and we have a large population. We have 1 million people in Westchester County, so these are numbers that are good. And so far we have had 108,000 vaccinations in the aggregate at the county center. That's been open 2 months now. They're somewhere in the vicinity of 2,000 people a day, maybe more, closer to 2,500. But 108,669, almost 109,000 vaccinations administered through yesterday. And that does combine first and second shots. So it's not exactly 100,000 people. It's a little number smaller than that because some of those vaccinations, 2 of them were given to certain individuals. The clinics that the county operates, the existing White Plains Health Clinic located in downtown White Plains, and the one we opened up about a month ago over at the community college, which is where I got my shot 2 weeks ago, has generated 21,264 vaccinations. And the next larger facility is the Yonkers Armory, which opened up 10 days, 2 weeks ago, and they've already vaccinated 9,500 people through this past week. And these numbers are going to continue to rise as they are operating on a 6-day or 7-day a week schedule. County Center, 7 days a week. The clinics that the county operates 6 days a week, but a very heavy effort to try to get those vaccinations done. We've done other things in terms of pop-up locations. The state has done pop-up locations in Peekskill and Yonkers and Port Chester and Mount Vernon, a number of places, because we got some additional allocation of vaccine. We were able to do a pop-up donation last week in New Rochelle on a multiple-day effort in Yorktown, in which we want to thank Supervisor Matt Slater of Yorktown for being the host community. We had tremendous assistance from Linda Puglisi, the town supervisor in Cortland, from Rick Morrissey, the town supervisor in Somers, and together they generated the bulk of the seniors that were targeted for that pop-up, and we had other people from elsewhere in northern Westchester, and we vaccinated 716 people in a couple of days at that particular site. And there'll be more of these around as we go along. But the challenges are really unique to each community. We have 45 municipalities in Westchester County, and they range from 2,000 plus people in the village of Buchanan to 40,000 people in the village of Port Chester. We have the city of Rye with 15,000 people. We have the city of Yonkers with 200 plus thousand people. And then we have towns in a range all across the board. Town of North Salem, town of Poundbridge, relatively small population. And then you have town of Greenburgh with over 90,000 people counting the villages. So everybody's in a bit of a different situation. In the village of Ossining, which is part of the town of Ossining, we have a concentrated population. It's a beautiful city. It overlooks the Hudson River. It has a terrific downtown business area. great restaurants in the community, solid schools, and so many things to recommend it. But because of the concentration, its urban element, even though it's a village, there's a concentration of population. And we have seen that the virus expands where there is a concentration. So whether it's in the four big cities, some of the smaller communities, the Peekskills and the Portchesters of the world, Ossining, because of that concentration, has seen a higher number of caseload for COVID. So Rika Levin is the mayor. She and her village board and her village administration have been dealing with this. They work in concert with the town of Ossining leadership, Dana Levenberg, who is the town supervisor. But Madam Mayor, please come and tell us a little bit about Ossining and how you've fared throughout all of this.
Thank you, County Executive, and I'm going to take my mask off. Thank you all. As I was introduced, I am the proud mayor of a village on the bank of the Hudson River. Really lovely. Come visit us anytime. We do have high concentrations in the downtown, and I want to discuss that in relation to COVID-19. Everything George Latimer said is exactly right. There have been pop-up opportunities for people to get both the vaccinations but also a lot of testing so that people can immediately go back to work. Still got to get tested to go back to your job. So that's been really helpful to the community. Westchester, the hospitals in the area have been really helpful in that. What's unique about Ossining, in addition to the to what we talked about, is that we have an amazing voluntary group. So OVAC, the Ossining Volunteer Ambulance Corps, has been inundated by calls in the beginning when we go back about a year now, because this is for us an anniversary of this occasion. And when I met with them this Saturday at an event, which I'll describe in a minute, they're now actually getting trained in doing vaccinations so that they're ready and able and prepared when we're able to do more and more vaccinations, when we get more vaccines. So the volunteer groups in Ossining are amazing. They've always been stellar in their ability to react to every challenge. And we also have a lot of senior homes. For those that know Ossining, we have both nonprofit and for-profit assisted living and nursing homes. As we all know, that's another area of concentrated living that has been hit really hard by COVID-19. My father lived in one of those facilities and died in April from COVID. And every family in our community has been hard hit, both in families that live in the area, as my parents did, but also we have many folks who are immigrants, first generation, and they were suffering an inability to visit their families in other countries who are similarly going through what is really a global pandemic. On Saturday, this past Saturday, we had an amazing event. Socially distanced, there were a few of us, and OVAC was there. We passed a resolution that every second Saturday in March going forward, we're going to have a COVID-19 day in Ossining. We are building a memorial park for all of us that were not able to be with our families, and all of us that would like to have a place to go to get some solace with our family. It's at the Veterans Sitting Park. We're adding 3 benches that are 6 feet apart, an empty chair taking a cue from our president that will sit there as a memorial, a little place for people to put flowers, for those of us like me who are Jewish to put a place for a stone as a memorial, and it is right across the street from a public school so that the kids could actually remember this from a historical point of view. Our website, through our village historian, which I hope other communities do as well, which is why I'm sharing this, is something I think that's unique. As you had said, that we're all different. So every community in Westchester is a bit different. So our differences, our village historians set up a website to create a historical moment now and not wait 30 years from now to learn about it, that people could tell their stories, send videos, pictures, so that we will build an archive of history virtually so that folks can look at it 20 years from now, 30 years from now, and whenever else they want to. Those are some of the key points. We were a yellow zone. We're not anymore, and everybody stepped up to the plate to really learn on how we can really deal with a pandemic from the civil service part, from the community, from government. And I have to tell you that when I look up not-for-profits, we have over 200 registered not-for-profits in a village that sits on 3.2 square miles on really at the bank of the Hudson. You're sort of like on a cliff, which makes it very pretty, but very, very challenging. And a lot of those not-for-profits stepped up with clothing, with food. The community center was used for food drives. And let me say that the county was an integral part of the food drives that we had in our community, integral part in getting masks, hand sanitizers to us, not later, but sooner. They came in within the beginning of this pandemic. I do hope you visit Ossining. We have lots of great parks and a waterfront park. As some of the regs are lifted and we're able to socialize a little bit, but I still want to see you in a mask, because until we're all vaccinated, still have to wear a mask because we're all still carriers until further notice. So I want to leave you with that as the exclamation point. Putting my mask back on in case anybody forgot what I just said. Thank you.
Thank you very much. Thank you very much, Madam Mayor. That's Mayor Rika Levin from the Village of Ossining. Thank you again for being with us, and good luck in the community. And hopefully the county and the village and the rest of the jurisdictions will work together, be good partners, and try to get us through this. Thank you again for your time. I'm going to mention a few things. I'm going to ask Deputy County Executive Ken Jenkins to talk about an element here that does involve local governments. But first, we understand that throughout this pandemic, it is the state government, primarily through the state executive branch, the governor and his key individuals, that establish a series of policies. And the policy determination factor is subjective. When the policies change at the direction of the governor and his key staff, we respond to them in terms of implementing things through our Department of Health. And so they have the state has announced that domestic travelers will no longer be required to quarantine after entering New York from any other U.S. state or U.S. territory starting April 1st. U.S. territories would be Puerto Rico, Virgin Islands, perhaps Guam, North Mariana Islands. There's a few other places out there that would fit that category. But the United States, any United state, not just the contiguous states, that you are no longer required to quarantine when you enter New York from being in any other U.S. state. The New York State Department of Health still requires quarantine as an added precaution, but mandatory quarantine remains in effect only for international travelers. So it's mandatory quarantine for international travelers. If you've been overseas and you're back, you have to do that. There is a form, the Traveler Health Form, that has to be completed and submitted. And, of course, individuals are encouraged, just as Mayor Levin just said, strict adherence to all safety guidelines to stop the spread, wearing masks, socially distancing, avoiding gatherings, and all those situations. If you have any questions, consult on the New York State Health Department website. You'll see the various directives that come from the governor and his people relative to this. But the good news here is that if you travel domestically, if you go down and see your cousin in Baltimore, if you go down to Florida or out to the West Coast up to Massachusetts, you do not have to automatically quarantine when you return. If you go overseas, you do. Any international travel will require that quarantining. Governor also signed legislation just today that grants public and private employees time off to receive the COVID-19 vaccination. We now have, as of Wednesday, the 17th, St. Patrick's Day, I might add, as a person of his proud, partial Irish-American heritage. On Wednesday, a host of different public-facing employees are now eligible for the vaccine. Ken's going to cover that. But what the governor indicated is that those individuals are granted up to 4 hours of excused leave for each of their injection visits, and it won't be charged against any other leave the employee has accrued or earned. This legislation is in effect immediately. It's an incentive to get people to get the vaccinations, those who work within governmental structures. And obviously, if you're doing the two-shot Pfizer, the two-shot Moderna, you get off the 4 hours for each of those two injection incidents. So with that, we're going to move to some of the changes that have come down from the governor's declarations that municipal employees are eligible. And for that portion of the update, Deputy County Executive Ken Jenkins.
Thanks, George. And in light of the governor's recent declaration that front-facing municipal employees will be eligible for the COVID-19 vaccine, Westchester County has been organizing the opportunity for these workers to receive vaccinations. We've been doing that through the local municipalities, and we're trying to do things in a specific way to make sure that we have everyone that has the opportunity to be vaccinated can get vaccinated. As the county executive pointed out, New York State continually modifies the things that are the people that are eligible, but they also provide a specific date for that to happen. So in the last declaration, the governor stated that anyone that's eligible can be vaccinated at any site. That's only the New York State sites, by the way. It does not include the retail locations, which are still reserved for those individuals that are 60 years and older. And there's still the pop-ups, as the county executive pointed out, that are targeted to specific groups to ensure that everyone has the opportunity to be vaccinated that wants to. Our understanding at this particular point in time, the county is going to receive a allocation of the Moderna vaccine to deal with the particular individuals that are in local governments. Once again, that means for those people that are in those local governments that will be targeting specific individuals, and you will work through your municipality to be able to register for those particular vaccine appointments. Everyone, while we encourage everyone to be vaccinated, there's not a law that's requiring it at this particular point in time. However, we want to make sure that everyone that has this opportunity, that's essential workers, that are front-facing. That means the people that are the closest to the communities, and we are starting that this week on the 19th and the 20th. For those individuals that are in public works, building inspectors, in those types of categories. So public works employees, the folks that have been essential from day one and coming out and individually intercepting and talking with individuals in the street as they take our rubbish off the street, as well as our building inspectors that have communications with people directly. We expect to receive these doses shortly, and again, that will start for us in Westchester County the 19th and 20th. This is going to continue as the vaccines continue to ramp up. The county executive has pointed out that we have been getting additional vaccines from both Pfizer and Moderna, and the president has said that we will have enough vaccine to get around to everyone who wants one by the end of May. So we'll see how that works as far as getting people the vaccines here and now getting those shots in arms. And as Mayor Levin pointed out, having everyone that can be able to offer those shots is extremely important. Please make sure, again, that for those individuals that are eligible, and on St. Patrick's Day, on the 17th, those municipal employees, those public employees are now going to be eligible to be able to sign up on the Am I Eligible website and be able to go from there. That is separate than the municipal distribution that the county is doing. Please make sure that you have an appointment. And once you do get vaccinated, you still have to continue to mask up, be able to social distance, keep the crowds down low according to the CDC regulations, and continue to wash your hands. Thanks a lot, George.
Thanks, Ken. Thanks again, Ken. We're going to touch on a couple of other issues that swirl around this issue of COVID. We sent a letter to New York State on behalf of school districts regarding graduations, and we asked the state to please lay out guidance for this year's graduations. You recall last year we were in the middle of the COVID pandemic when schools had to make decisions on graduations. Large gatherings were ruled out for the month of June, and every school district had to do something. Each one did something a little bit different. There were a couple of drive-in graduations that were done. The county hosted a couple, and there were a couple done outside of that, and there were some schools that didn't have graduations. And, of course, that's an important part of the educational process. Any of us who've already been through high school, college, look forward to the graduation period of time. It's a time of great sense of accomplishment, a great socialization. The friends that you've been through up to high school you may not see again in the same context for either a long time, if ever. And so we wanted the state to start to prepare to give us directions so that we could work with school districts where necessary, or school districts themselves could start to make appropriate plans. We have tried very hard as a county government to do that which we can do with the school districts. There has been, I've shared this before, a misperception that somehow the county has been given the authority to open school districts. We have not. That power rests with the local school districts. But there are two elements of county involvement that we do have. Number one is vaccinations and making sure that we vaccinate school personnel, teachers, and others so that there's a greater comfort zone when a school reopens to in-class training, and then also that our Department of Health serve as an entity to consult with and to assist in the decisions that are necessary to open the school at proper health levels. And of course, the state has set a standard that does involve some interpretation. County gets involved in that interpretation in our Department of Health, but it is not the same as having the absolute decision to open or close a school district, which still resides with those school district individuals. The new regulations issued by New York State permit outdoor social gatherings of up to 200 people, indoor events to occur with proper direction, and some state guidance has suggested that the attendees of an event would provide verification of a negative test in order to participate. All of these rules have to be outlined as clearly as possible, and that's really what we did in communicating with them. We wanted to show our support for them. We're trying to stay ahead of the decision cycle. Decisions on how graduations are going to be structured really can't wait until the month of June when the graduations would be held. And we think getting a direction by the end of March, early part of April is essential. We're going to comply with state direction, but we basically said, here's what we intend to do. And if you want to tell us don't do it, tell us now. But in the meantime, we have to work with these local school districts. And in the same way that I talked about being a partner with Mayor Levin and supervisors and mayors of big cities, so we intend to be partnered with the school districts. I think we've had a good partnership with them. There have been, rocky bumps in the road because none of us have gone through a pandemic before. And even in the second year of the pandemic, issues arise in this year. That's a little bit different from what we had a year ago. A year ago, the whole of society was shut down. The parents were home. They weren't out working. And when you shut the school districts down, they were there with their children. Now you've reopened most of the economic structures of the country, and most of the jobs are back in business, those that are still there. And that creates a different kind of dynamic for kids going to school. So there's a host of things that are different, but we want the Westchester schools to be able to have the opportunity to move forward. We have our usual bits of information that will scroll at the bottom of the screen, all of the different websites established by the state. Whether you're eligible or not, you can find that out on how I am or am I eligible at covid19vaccine.com. We have the hotline number there for questions, 833-697-4829, the vaccine forms, and then also some other information that you may need to know. All of these things are complicated. It does require having some exposure to communication by electronic means and a comfort level being able to work your way around in order to get the information that you need to help make an appointment or to know how to respond to the different situations that we face. And in a completely unrelated element that does tie into what the county has some control over, we made a point last year when we were going through the shutdown of society that we were left with the authority to decide which of our recreational facilities we would open and which ones we chose to close. And we made the decision to close on the basis of could they be managed effectively or not. A year ago, we made the decision we could not open Playland successfully. The beach was open, the boardwalk was open, the nature park was open, but the main amusement park was not. This year, that order has been lifted, and we're planning to open Playland in late June. And the first thing that we opened recreationally, aside from all of our parks that you can always walk through, walk on the paths, bicycle on the paths, is we opened our 4 of our 6 public golf courses. And because of the current snow conditions, we were not able to open all 6 this weekend, but we did open the 2 in Yonkers, Dunwoody and Sprain Lake. We opened the 2 in the Sound Shore, Maplemore and Saxon Woods, and we held off over the weekend opening Mohansick and Hudson Hills in Yorktown and Ossining area, respectively. However, Hudson Hills opened today. That's good news, Madam Mayor, in your backyard. They're open today, and Mohansick will open on Wednesday. And, of course, this time of the year, it's very early in the year. We wanted greens and fairways to get a bit of a rest. We closed it at the end of the year, calendar year, gave it 2.5 months, reopen it now. It's going to be a little soggy in some places because of the winter snow and the cold and so forth. My friends who are golfers, I am not a golfer. They would be golfing the first week of the new year if they could. They love the sport, and it's reflected in the fact that last year we had over 267 rounds of golf, which is 40% higher than what we had in 2019. Everything in the pandemic last year was affected, was less than the year before, except for our golf program and our Bicycle Sunday program, which had record years in both cases. So we opened up the golf courses for them this weekend. We already had over 1,000 total rounds of golf, so we're off to the races at each of the different golf courses now that all 6 of them are open. And our intent is to try to responsibly open everything that we can justify, that we can manage. And if we fail to manage it correctly, if we see a spread beginning to happen, we will shut it down. We're not going to be attached to ideology. We're going to do what is practical to make sure that you can have recreation at the same time you can do it safely. And so that's at least a little bit of good news on this. I'm going to take some questions in a second. We don't have any questions. So anyone who's out there with the press, if you have any questions for us on COVID or golf, which we talked about here in today's report, we're happy to have you contact Catherine Chaffee, our Director of Communications, 995-2932, and we'll be happy to follow up with you. I will be making a video statement regarding the issues surrounding the Albany accusations in a little bit. It is a very sad chapter that we're dealing through, and even though I'm a county official, I have spent time previously as a state legislator, so I understand, that these issues, even if they're a different level of government, affect the way we are. I intend to make a statement which will be shared by video, online, and to the members of the press to clear up any questions. There have been questions that have come our way. Rather than try to answer every one, we'll try to make a statement that we hope is helpful and gives you a sense of where we're at, and then and really, though, focus on what our jobs are in county government. We have, and in local government, in the villages and the towns and the cities, we have very prosaic responsibilities. We have a county police force. We run a jail. We run sewer treatment. We have a bus system. We run an airport. We have social service administration. We have community mental health, and we have a variety of different other functions in it. And so some of the things that happen in Albany and Washington are as interesting to us as they are to you, but that we don't have any particular direct inside involvement in those things. But on this particular matter, we'll make a statement and share that with the public. Absent that, we will be back again on Thursday at 2 o'clock for our end-of-the-week COVID update. We hope to see the numbers continue to drop. It'd be nice if it's a little bit faster. I'd love to see us get under the 5,000 case mark. If we can do that, I'd love to see our hospitalizations get under the 200 mark and see some progression. We continue to distribute PPE and both masks and hand sanitizing in different locations. This weekend, I was involved in a distribution at a senior housing project in Portchester, and we try to do that every place we can. And we try to continue to live our lives as healthy as we can and as respectfully as we can. So thank you for watching. We'll see you on Thursday. We'll have some other things that will happen between now and then. But do stay safe. I'm George Latimer, County Executive. Thanks for watching.